Okay, good evening everyone. Welcome to Masa webinar series. So for today's webinar, it is brought by Department of Medical Imaging, Faculty of Health Science. And for today's topic, it is innovation in medical imaging. And we have our honorable speaker to speak on that. But before we proceed with introduction to our speaker, let me just explain a little bit about the webinar today. So to all audience, you can leave any comments or any question in the comment box below, and I will read out all the questions at the end of the session. All right, so we have our speaker today with us, Mr. Safwan. Do you like to say hi to all the audience first? Mr. Safwan, you maybe want to unmute your microphone first.
Oh yeah, hello, hi everyone, Safwan here.
All right, thank you very much, Mr. Safwan, for being with us today. So before we proceed, let me just share with all the audience a little bit about Mr. Safwan. All right, so Mr. Safwan is basically a lecturer in Medical Imaging Department, Masa University, and he graduated with his Bachelor of Medical Imaging from Mara University UiTM, and also he has completed his Master degree in Radiation Safety and Nuclear from UKM. And previously, he has been working as a medical product specialist in sales and marketing for a few years. And now he's a lecturer in Masa University in Medical Imaging Department, which he teaches both programs. We have Diploma in Medical Imaging and also Bachelor of Medical Imaging. So I think with his boundless experience in working in medical imaging field, it is very great pleasure for us to have him here to share his experience and his knowledge on the innovation in medical imaging. Okay, Mr. Safwan, you the screen is yours, Mr. Safwan.
Okay, thank you for a brief introduction, Ms. Shafinas. Pleasant evening to you and everyone here. Thanks for joining us in our webinar series, Medical Imaging. And I should start by thanking organizer for this opportunity to share my knowledge in medical imaging. Okay, first let me share my screen.
Yes, please.
All right. Okay. It's from Faculty of Health Sciences. I'm Safwan Awang from Department of Medical Imaging, lecturer. Today I'm going to talk about innovation in medical imaging, which is I will focus on the medical technology with two topics. Number one is the imaging trends in 2020, as well as the future of medical imaging. Okay, the future of medical imaging and imaging trends in 2020. I think we should thanks to the innovation and also technology, because it will like keep improving the process year over a year, decade over a decade. It always something new coming to us. Okay, so let's first start with the medical technology advances, right? So, well, since 1895, as we know that medical imaging that has undergone a near continuous innovation. Okay, it's never stopped actually, because after the discovery by Röntgen, so medical imaging keep continuous innovate something new, always never stop the continuous innovation. Okay, so well, the innovation is a broadly used word, but what is innovation actually? Okay, so innovations by definition is refer to the creation of a better or something to more effective products. It's a process, technologies. Okay, it's a technologies, it's idea that are accepted by trades, by the society, and by government. Okay, this one is by Wikipedia. Uh, that is the actually the innovation. Okay, so as we can see, what is good about the innovation? Okay? What is good about that? Okay, so the technological advancements in medical imaging, we have to look at it. This is will offer a positive outlook in the field. Okay, in the field of medical imaging. Okay? So because the innovations keep continue with a new technologies year by year and times by time, means it will change the landscape of the medical imaging. Okay, and then it will rapidly continues and leading to more modalities becoming up in the market. That is good about the innovation, about the research actually. Okay, the new discoveries, which is nowadays people are focused more to the computerization in the imaging technologies. In fact, the computerization now is the place of X-ray, and that is the part of the innovation. Okay, so the three topic that I will focus is number one is the advanced combination in imaging procedures. All right, so so-called hybrid imaging. Okay, in a research, they always call it as a hybrid imaging. It's the advanced combination of imaging procedures. Uh, I will also touch on the integrated 3D imaging. This is also quite, I think it was in 2018, people talk about the 3D printing. And then the recent one, and then this is will continue in 2020, which is in 2020, is artificial intelligence or augmented reality. Okay, it's artificial intelligence industry, AI. Okay, and then in medical imaging disciplines, because we have various imaging machine. Okay, so it will have a constant innovation in medical imaging. Okay, like talking about neuromolecular imaging. People now talking about the nuclear cardiology machines, about the cardiac imaging. It's very advanced technologies. Speaking about the cardiology, nuclear cardiology, the PET-CT, okay, the positron emission tomography, the computer tomography itself. It also have the very advanced slice, very so advanced already with the player in the market, like just to name a few, Siemens. We have a General Electric, we have a Philips. So it will keep the momentum is already there. Okay, in ultrasound, such as we have a robotic assisted surgical ultrasound. Okay, and then it's a part of the artificial intelligence, the digital radiography, and then of course it's a big industry in magnetic resonance imaging or MRI nowadays, because we have the functional MRI. Okay, and the functional magnetic resonance imaging. So this is all this medical imaging discipline is content innovation actually. Okay, so as we can see here, I shared a little bit the evolve of the medical imaging industry, like from the general X-ray, for example, that from analog now move to digital. Okay, nowadays I think all the medical imaging machines move to the digital technology. Okay, some still got the analog, but that is the evolvement of the general X-ray. And then CT scanners, for example, last times the scanners is less than 16 slices. And then now, like today's, they keep updating 16 slices, 60, 64 slices, 128 slices, or even more. Okay. Then MRI scanners last time is less than 1.5 Tesla. As you can see today, 3.6 Tesla, even more 7 Tesla. And mammography, the player in mammography also moved from analog mammogram procedure examinations to the digital mammogram. So as we can see, like there uh, so many innovations and the improvement of the medical imaging technology. Okay, now let's talk about the research and then the player in medical imaging industry. Like in year 2019, I'm talking about the meeting of the Radiological Society of North America, RSN here. It's a common seminar. It was in Chicago. Last year, people talking about they moved from hybrid imaging. Last time, people talking about the hybrid imaging, the combination of the machine like PET-CT. From hybrid imaging procedures, now they move to artificial intelligence. Now, artificial intelligence is everywhere now. I believe that it's not just in medical imaging, but in other industry. Artificial intelligence is very common nowadays. Okay, so well, because it's now it's 2020. Okay, it's a new decades means a new technology. All right. So yes, I agree with that because we are now living a new decade. Okay. So it's a new decade means a new technologies which is including the innovations, including the innovations such as hybrid imaging. All right, hybrid imaging and artificial intelligence. All this like they move from hybrid imaging and then keep updating with the artificial intelligence. Okay, I put the reference also. You can have a look later. All right. So during the RSNA, a little bit summary on that. I would say is the explosions of AI technologies. Okay, the explosions of the AI technologies, which is it shows that 40% of the conference, the vendors, participants, they talk about the development of triage of mechanism, which is, for example, they can detect the brain hemorrhage. Okay, can detect the brain hemorrhage with the technology. Okay, basically the AI technologies is intended for stroke detection. Okay, uh, as we can see that the development of tools which that automatically what they use to detect the large vessels occlusion, and this will send alert to the people on stroke team. So see there is the combination, the link to the pads. So that is the part of the advancement technology in the medical imaging, especially like those involved in the angiographic procedure. Okay, so but also I would like to mention here, FDA at this moment approving applications of CT of AI, which is just to use for detection. All right, actually AI in medicine is just used for detection, but not yet for diagnosis, because you might wonder, is this artificial intelligence will replace the clinicians and the technologies? But so far, that is the standard that FDA established, which is the artificial intelligence tools that have been approved so far have their specific application. Means it's still under control. It's to be controlled by the FDA. Okay. Artificial intelligence has dominated session on tracks and titles, research titles, conference, seminar, and imaging conferences, and industry headlines for several years already. But I believe 2020 is become even more. All right. So that is the fact that we are going through, right? We are facing right now is the technology. There is a technology and also the computer update. Okay, while it has the potential in the long term to dramatically alter medical imaging, that's what people believe also. The potential is there, but well, it's controlled by FDA. It's a limited FDA, which is its clear application for the use of AI in digital radiography and adoption in the healthcare sector. Overall, can seem like has been quite slow. Okay, because yeah, it's a we're talking about the medical. Okay, uh, like okay, this is I think this researcher out there is actively doing research about radio mix. All right, so it's a part of the artificial intelligence. Right, it's a part of the AI. Is the radio mix. What is the radio mix actually? Radio mix is radio mix. They refer to the automated. They use the word automated, which is actually use the quantification, all right, of the radiographic phenotype. Okay, so that is the radiomic. Radiomic is a refer to the automated quantification of the radiographic phenotype. Okay, so radiomics is rapidly evolving the field of research. Right now, uh, artificial intelligence, one of the like, broad component that people choose as a research is radiomics, right? So which is concerned with the extraction and quantification of patterns, okay? Because this is medical image, right? So with the extraction and quantification of patterns, the so-called radiomic features, okay? The radiomic features within medical images. All right. So this is within the medical images. Okay. So radiomic features, radiomic features basically will capture the tissue and then will capture the lesion characteristics such as heterogeneity and shape. Okay, so that is the function of the study of radiomic. It is focused on the medical image, but the study on the because it refers to the phenotype. Phenotype is a part of genomic. All right, so radiomic features capture a tissue and a lesion's characteristic. So that is they study the image actually. All right, and may alone in combination with they take the demographic data, histological, genomic, or proteomic data be used for clinical problem solving. They try to take the medical image data and then combine with the clinical problem. Okay, so this is again another branch of the medical imaging with the computer science. All right, because as we know, like last time, medical imaging formerly we talked that as a diagnostic tool for disease. Okay, but now as we can see, now is medical imaging also is used to treat, to manage, and to predict of the illness. That is the medical imaging nowadays. Okay, like radiomic data has the potential. This is something interesting because we can see not just by the naked eye. All right. So radiomic data has the potential to uncover disease characteristics that fail to be appreciated by the naked eye. All right. So it will give a better image, and then we find the abnormality, the illness, which is unseen with the naked eye. So the imaging algorithms quantify the state of diseases. All right, so quantify the state of diseases and thereby provide the valuable information for personalized medicine. So involved of the imaging algorithm, right? The image and the algorithm, it's just like CT scan. We take the image and then we record of the image, which is radiomic has emerged from radiology. Actually, radiomics has emerged from radiology, because radiology is study about the tumor, but cancer. But it can apply in other disciplines in medical imaging. All right. So these two people that involved is basically it's a engineered features, the study of deep learning, medical imaging as a medical imaging technologies. We also will directly involve with the process to get the best medical image for the purpose of medical specialist interpretation. Okay, so that is artificial intelligence. So now let's move to hybrid imaging. As I mentioned to you, it's a combination of machines. So this is the hybrid imaging. Okay, so from the word hybrid, we can imagine we have more machines. Okay, so what's good about that? Okay, it makes the unit easy to switch, like for example, between CT and fluoroscopy. That we have the CT fluoro nowadays. We have PET CT. We have PET MRI. We combine machine. Okay, combine the machine makes the units easy to switch between CT and fluoroscopy in just a minute. So it helps. What is good about that? It will improving the efficiency. All right. So it also will improve the patient's experience. All right. We improve the patient's experience. Okay. So hybrid CT has a especially significant impact in the area of interventional oncology in particular. Then hybrid imaging also provide highly accurate depiction of the volume of the liver. For example, is the liver, the radiation is being delivered so that the appropriate dose can be administered. Because why radiation is is meticulously delivered to the tumor. Okay, that is the target. That's why we want the combination of the machine, the hybrid machine. So and it will not give at the surrounding area. We just target and then meticulously delivered to the area. Okay, you can see the reference here. That is hybrid imaging. Now, I want to touch on 3D printing in medical imaging. Okay, 3D printing in medical imaging before artificial intelligence is a 3D printing, which is, as we can see that in the engineering, with the advancements of 3D printing in recent years, like cardiologists, surgeons have been able to make more informed interventional plans using 3D models. Okay, so that is the 3D printing actually, because we, as a medical technologist, medical imaging technologist, as a radiographer, we use the CT scan to give the precise data in order to produce the best 3D models. Okay, it helps in the process of medical process, like radiologists and surgeons. Okay, so this dimensional modeling has potential to improve overall surgical outcome while like increasing the efficiency of procedures. And yes, this is something also very important, ultimately decreasing the radiation exposure, because in medical imaging it always comes together. Okay, image quality and dose. Okay, radiation dose. There is no point if we have the best image quality, but we jeopardize the radiation dose to the patient. So it always comes together. All right. So as we can see, a little bit I shared about the current research. Okay. 3D imaging, image reconstruction, which is play prominent roles in diagnosis, treatment planning. Okay, this I share from Hyun Woo Gu et al. Like by 3D printing, that medical specialists can understanding of the complex morphologies of the congenital heart disease. Okay, for example. This one I share about the Jordan Gosnell et al. Like he mentioned that 3D printing is an emerging technology that aiding diagnostic education and intervention. However, the imaging modalities may not provide adequate visualization of complex CHD. So therefore, hybrid imaging is there and come up with the artificial intelligence of 2 or more imaging modalities has the potential to enhance the visualization of cardiac pathomorphology. So that is the 3D printing. Okay, so this technology advances is I truly believe it will shape the future of diagnostic imaging. It will truly transform the medical imaging industry. So it's a plenty of job operating out there. This industry is become like significant role in healthcare providers. Like it created a faster and more precise imaging, which is I would say is less invasive. Okay, it's prominent role in healthcare. Okay, in medical imaging, this translates to improving diagnosis while keeping dose as low as possible. All right, so it's always dose and there's no point to have the best machine, but you improve the patient. Always come together. Okay, so improving diagnosis while keeping dose as low as possible. That is the ALARA concept. And then, of course, it's increasing efficiencies to minimize the cost. Okay, the overall healthcare industry is striving to make healthcare more effective. Yes, so many vendors, so many clients. I believe educational institutions, researchers will keep continue the best research. They come up with a new knowledge, new idea. Okay, so a little bit I want to share about the radiation dose management. As we can see that several vendors are increasingly focused on the developing cloud. This one is quite new, I think, because I'm talking about the future in medical imaging, right? Developing a cloud-based radiation dose management software, which owing to their various advantages, right? What is about the cloud-based radiations? You can see it's a software, because the software is a data. As we know that software need a data. Okay, we say data is a food for software actually. Okay, so it enables increase in productivity as it allows access, sharing, exchange, and viewing of data from anywhere and anytime. So that is good about the radiation dose management. Again, I stress here, it always comes together, image quality and dose management. Okay, that is the reference. It's quite new. It's March 13, 2020. Okay, I would also like to share for the last 6 years teams from the University of Liverpool's Department of Physics. As you can see that the Royal Marsden and Royal Liverpool University Hospital have been working to develop an imaging system which is known as TIPICT that will better measure the absorbed radiation dosimetry. Okay, so this aim to produce more accurate treatment and diagnosis of patient. Yes, that's the ultimate objective lah. The aim is to produce more accurate treatment and diagnosis of patient. And then now you can see the smart injectors. This is also the power injector. Also have a new technology, because the issue with the injector as the concentration of the medium, because it's always say like high concentration tend to produce high quality image, right? But the problem with the high concentration is viscosity. All right, which if you can see that viscosity rises with the concentration. High viscosity can cause extravasation, which can harm the local tissues, We don't want that. Then they believe that the good way to go is adjust the protocol to use a lower concentration of the contrast agent. But as we can see from the player like Bayer, Breco, GE, Gerbert, what else? Sinomedical, the now working on these smart injectors, is known as automatic injector device. We said, as mentioned here, when it comes to listing the needs, patient safety ranks at the top. So that is part of the smart injectors. We have the technology today to monitor the patients via sensor. So they now develop the sensor. Okay, so tracking radiation dose, to keeping track of radiation dose is critically important to minimize the amount of patient radiation, which is essential to patient safety, right? Keeping track of radiation dose is critically important to minimize the amount of patient radiation. Always talk about the amount of radiation that received by the patient, like BRACOS, NEXO, information system that for those that can track patient radiation exposure automatically, regardless of type of imaging system. So this is also the future of medical imaging coming. New machines, new technology, new knowledge. I would say a new technology. Okay, and then it's like nuclear medicine, for example, that we have PET, we have SPEC, radiopharmaceuticals, the tracers. This is also a very broad the field that can be explored, like the combination of PET CT, PET MRI, digital PET CT, that they will say that it improving the patient experience. Okay, so it's increased efficiency and image precision. Then in nuclear medicine or molecular science or radionuclide imaging, these new technologies will continue to grow and flourish in a global market. Okay, it's around the globe. And then radiomix also in nuclear medicine. Okay, as I explained to you just now about radiomix, which is the potential clinical application in nuclear medicine that include the prediction of treatment response and survival based on PET and radiomix features. Okay, so now I move to my conclusion. All right, as we can see, in conclusion, like I would say, innovations in medical imaging is the result of it, or the benefit of it is it will be a more accurate, okay, improving both sensitivity and specificity, because we are talking about the machines, so we have to take into considerations the sensitivity and specificity. Okay, so like 3D image and has the capacity to provide visual presentation or augmented reality. Yeah. Then in the future, if predicting diseases and imaging will play an important role. Okay. Prominent role of the medical imaging is forever. Okay. It's a what would say diagnostic and treatment tools in medical science. Okay, so here I share my references for today presentation. Okay, and then it's on my last slide already. Just a recap of my presentation today. First, I talked about the emerging trends in medical imaging for upcoming year 2020. Number one is artificial intelligence. Number two, augmented intelligence. Number three, hybrid imaging. Number four is 3D printing. Right? So now let's take a look on the future in medical imaging. Yes, its problem is radiation measurement, smart injector, and a lot more. Okay, so with that, I end my presentation for today, and then thanks everyone. I pass back to Ms. Shafinas. our moderator for today. Thank you.
All right, thank you very much, Mr. Safwan, for a very fruitful and very beneficial sharing session just now. It is so amazing to see that there's a lots of new innovation in imaging, medical imaging, as we move forward to 2020. All right, I am quite interested in the 3D printing and also the hybrid imaging because I can see that it is really helpful in detection of the disease, right? Okay, thank you so much, Mr. Safwan. Now we move to the Q&A session. To all audience, if you have any question, please write down your question in the comment box and I will read out the question for Mr. Safwan to answer. And there's a question from the comment from the audience that joined the webinar today. So let's see the question. Okay, there's a question from Sharmila. Is the 3D model construction in practice now by hospital before proceeding with surgery?
Okay. Okay, I think this question from Ms. Sharmila. Is the 3D model construction in practice now by hospitals before proceeding with surgery? Yes, 3D is already in the market, Ms. Sharmila. And then, in fact, company actively hiring those with a knowledge in 3D printing, those with medical imaging graduates that, like, to name a few, like Materialize company, they're looking for what graduate in medical imaging to work as a 3D printing specialist, because you need to produce the very precise 3D model before they send patient for the treatment. So it's already in the market.
So it means that the most of the new innovation in medical imaging is actually available in Malaysia, is it?
Yeah, I would say so, because I believe Malaysia ready for it. We take the challenge. We are here. We, as a medical imaging technologists, medical imaging, we are here to take the challenge. And of course, most of the hospitals in Malaysia now already have these technologies and machines.
Yeah. Okay. Thank you, Mr. Sapuan. And actually, I have my own question to you, if you don't mind.
Yeah.
So, as what you shared with us just now, we have in medical imaging itself, we have lots of innovation in the technology. So, in your opinion, do you think that the medical imaging field will the trend or the continuous innovation in medical imaging field will affect the current trend, especially in the healthcare field? Is it what are the factors that affect the medical imaging to keep on evolving, to keep on creating a new innovation in their machine, in their tools, in order to get a better result of detection of disease or even the diagnosis?
Okay. Okay, thanks, Ms. Shafina. I think it's a good question. Correct, because I also wondering, right, why people keep evolving, keep producing a new image. Yes, because we try as much as possible to reduce to reduce the like, for example, the open surgery. We try to go to less invasive procedure. So that's why this machine or this technology is coming up, because, for example, artificial intelligence, you don't need the open surgery anymore. So that's the impact of technology in medical services provider. Okay.
All right, thank you. We have another question from the audience, from Miss Nina. The question is, what do you think will happen to the job scope of radiographer when most of the imaging modalities will be replaced by artificial intelligence AI in the future? Does it will affect the functional of the radiographer because it has been replaced with all the new technologies?
Okay, that is also interesting, that question, because Yeah, you are busy talking about the robotic, right? Well, I would say, yeah, remember in my first, second slide, I said that this technology actually will give a positive impact, outlook in the future for both clinicians, technologists, patient. Why? Because this machine, that's why they call as artificial intelligence. I mean, it still needs a brain. For now, we still need a good brain to operate this machine. That's why, like,
It means that
even
we
though
still need someone to operate the system,
correct,
right?
because we are not talking about robotic. We are talking about
The
it's just artificial intelligence. Yes, correct. For augmented reality, for example, you can do a surgery. It's lively, like from a different room. But yes, you can see that the radiographer, clinicians still play a significant role in this industry. I know you're
yeah.
concerned about what the question. So it's a good question.
So we can say that the radiographer is still needed. Okay,
Yeah,
so don't worry about your job scope.
definitely.
You're still required to handle the system. You're still required to do some of the procedure. It's not totally 100% controlled by
Repeat.
the system, right? Okay, so basically, we can say that all this innovation is helpful to help the radiographer. It's not just like 100% pass over all the duties of the radiographer in doing the procedure, right?
Yes, correct. Because I would like to add something. Because as you can see, this is good opportunity for us to come up with a new knowledge. We always have to challenge ourselves because this is a new knowledge already in the market.
Yeah,
We
I
should go
agree.
for it.
Yeah.
Yes.
Right, thank you. We have one more question from the audience. Let's see the question from Mr. Darwin. Um, he's asking, what's your opinion on analog and digital technology? Based on your opinion, sir, which is best and the common difference between the analog and digital technology?
Okay.
For the difference.
Um, okay. As I mentioned in my slide, right? Last time, analog is common in medical imaging. Now, we have to accept the reality is all replaced by digital technology, fluoroscopy, even mammography, even digital radiography. People move from computerized radiography now to digital radiography. Uh, Talking about good or bad about that, I cannot say analog like
It's
is no
bad.
good at all.
Yeah.
It's still there because maybe you're talking about the what image quality, all right, about the contrast,
Yeah.
yeah, and then about the dose to the patient. Maybe digital radiography or computer radiography will increase dose to patient. People are still doubting about it. People are still talking about it. Okay,
Yeah.
and of course, just I mentioned that we have to take this challenge. It's coming up to us already. We are now in the era of digital, IR 4.0.
Yeah.
So yeah, thank you, Darwin. It's a good question also. It's something
Basically,
not bad.
we don't really can say that analog is the best or digital is the best, but
Correct.
as we move to the new new era,
Mm,
new technology, so we have to follow the trend, right?
exactly.
All right. So if there's any question, please write down the questions in the uh, comment down there. Anyone? Any more question? Let's see. Oh yeah, there's another question. With regards to the COVID-19 pandemic, could you share with us how the medical imaging profession can help with the detection or diagnosis of the disease? Because you have mentioned there's a lots of innovation in medical imaging, so I'm sure that there's some of those innovation helps to detect more disease or accurately identify the coronavirus or specifically the COVID-19.
Okay. Oh, thanks for the question also. Right? If with regards to the COVID-19 pandemic, could you share with us how the medical imaging profession could help with the detection or diagnosis of the disease. Okay, uh, like as we
Maybe
know,
maybe you can relate with the innovation, like you said, we have the 3D printing or
right.
the hybrid imaging. Is that any of those innovation help in the detection or diagnosis of the disease?
Yes, 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 sure. Because well, pandemic. Okay, it's the word pandemic means it's attacking like around the globe. All
Yeah.
right, so I think that the world affected by that, and I believe researchers out there, so many researchers in medical imaging or maybe from the other discipline, actively doing research about the diagnosis and the treatment of COVID-19. And then, as you can see, like I just uh, found out that the information available from in the recent journal, like a computed tomography, for example, will like very fast in detecting like pulmonary edema, inflammatory with the children's, with the chest of CT. This we can see this is like the rendering of a CT image. So that is, you can see the benefits of uh, innovation, technology, like 3D printing just now. It will foster the what it will what we call
Reduce
enhance
the oh,
and then reduce the time. We give more what we call a better diagnosis, better treatment. Okay, so of course you can check that even free journals available internet. You can go to radiological society journal. You can go to the journal of nuclear medicine. You can go to computer tomography journals. That's a lot of the, I think it just recently published. I believe it's just published in April, May, with a so advanced image. Is so great CT image of a chest. Okay, the thorax image is very advanced. Okay.
okay. What about when we talk about the new innovation, it always come with cost. Okay, do you think that the cost is a factor that some of the innovation cannot be implemented in the hospital? You know, because I'm sure that all this
You're
innovation
wondering, right?
comes with cost. You know,
Yeah.
so if there's any factors that relate to the cost?
Correct. Yeah, yeah. Because yeah, you know, right? In medical imaging, is always stigma. It's expensive. I think. Yeah. I'll say like yeah because we need a budget on that. But I try to put this way lah. I mean, like, because this is technology, advanced technology. Of course, it comes with a price, but with what hospitals or the stakeholders we spend, we give better benefits. Okay, so I couldn't say like it's a cheap. Of course, it's expensive.
Of course, it's not right.
Of course, because it's a advanced machine. Because we are talking about high-end technology. We are talking about high-end technology and some more in medical lab.
Yeah.
Okay, so
So maybe the benefit of it will be more than its cost. So it should be what we call reasonable to have all those innovations, right?
yes, like for example, now I'm talking. I think like about smart injectors for now, right? Like
Mm-hmm.
maybe wondering for extravasation, maybe no need. So like the what we call the sensor to detect the extravasation, because it's not always happen, but it's good to have that. I'm right because it's extravasation. It can damage the tissue. It can lead to amputation. So it's okay to spend because of course this because it's software. If we come with a package and different package. That is one of the example in
Mm.
power injector or mechanical injector. Okay.
Okay, so we have been talking about the good side or the benefits of having those innovation in medical imaging. In your opinion, what about the side effect of it? Is there any um, disadvantage or drawback of those innovation? Because there's always two sides of
Mm.
good side and bad side. So do you think is there's any like a drawback from those innovation like in the 3D printing, that hybrid imaging and even AI?
I have one word for that. When it
Mm.
comes to patient safety, yes, definitely.
Patient
When it
safety.
comes, yes, when you have to jeopardize the patient safety, because in medical, patient safety is always come up to the rank. The patient
Mm-hmm.
safety is always a top priority. There is no point if you have a very advanced machine, very good technology, but you have to sacrifice or you have to jeopardize the patient safety. Because, of course, in clinical services provider, patient safety is our what we call parity, our goal. And then in medical imaging science, we try to give the best image. Okay, we play a significant role as a medical team together with uh, radiologists, cardiologists, surgeons, nurses, and other like have professional like even now during the pandemic COVID-19. Actually, radiographer is also part of the frontliner.
Linus, yeah.
Yeah.
Okay.
Yeah.
Do we have any more question in the last comment in the from the audience?
Okay. I think yes, it will change the landscape of medical imaging. So trust me, the job opportunities awaiting you out there. It's not just in the clinical side, but also in the like multinational company, for example. You can become a product specialist, you can become a application specialist,
Yes.
even the what uh, uh, service engineer.
So it
You can
involve a lot
also,
of people, right?
yes, also in the clinical, definitely in the clinical as a clinical team, like interventional radiology, for example. You as the in the OT, in the what angiographic room,
Yeah.
intensive cardiac lab.
All right.
Okay.
Okay, Mr. Sapon, we have another question from the audience.
Mhm.
Let's see, the question is from Miss Nita. What do you think the current use of digital imaging in
In
Malaysia?
okay,
Current,
uh, thank you very much. It's a current use of digital imaging in Malaysia. Okay, uh, talking about this, last time, just a big hospital, big size hospital uh, that moved to digital imaging. But now, I think almost all, actually, I think almost all the hospitals, of course, it's governments, private hospitals, clinics, GP, now they start what we call replace the analog machine with digital machine, and at affordable price already for CR, computerized radiography, for DR, digital radiography. In fact, digital fluoroscopy, also digital mammography. Okay, and then yeah, I'm talking about the general X-ray lah. I mean, like when you move to the CT scan, for example, the CT scan now like 64 slices, common. It's quite common in the market. It sounds like 1 to 8. Yeah, a big hospitals. Uh, well, for me lah, personally, I think it's good to see this improvement in medical imaging actually because it's accelerating. After I believe, I think like I recall back in was back in year 2000 somewhere 2012, 2013, 14. Now we are now in 2020.
Mm-hmm.
That's why I try to share with audience today about the innovation, and this will keep continuing.
Yeah, we
And
can see the
more.
like the chronology from one stage to another stage. They keep on improving and keep on innovating. You know,
Correct.
like you mentioned in your slides
Right,
just now,
right.
the slices of CT scan from 64 and goes to 128. So it means it keeps on um, evolving or innovating to the new technologies. Okay.
Yes.
Um,
And then in the end, it will help the patient to live longer. So that's very important. That is the purpose of it actually. Okay, it's not just a technology, because we are in medical field, medical line. We are talking about the purpose is to help patients to live longer and healthier.
yes. Yes.
That is
Correct.
our objective.
All right. Okay, I think that's all for our session today. But I just want to share with all the audience, we have another session of webinar on this Friday. It is on the roles and the safety of the radiographers during the COVID-19 pandemic. So if you would like to know about the rules and the safety of the radiographer, please don't forget to join us on the next session of the webinar. It will be on this Friday, 3rd July, from 4 p.m. And it will be a very great session because we have invited another honorable guest for the webinar. Okay. And don't forget to follow us on the social media, our Facebook. Please follow and like Facebook Faculty of Health Sciences, and also the Facebook our Department of Medical Imaging. And one more thing, we have online course that will be conducted in August on the radiation dosimetry. So for any audience who are interested to know more about this course, please like, follow our Facebook page, Masa University. Any information will be updated there. So please don't miss out the chance to join our online course. And please don't forget to share and keep on updating with our uh, information. Okay. You still can leave any comments or suggestion in the comment box so that we can still see your comments or any ideas or suggestion. Okay. Or we can reply it later even after the session has ended. We still can reply to your question. Okay. And to all the audience, in order for you to get your e-certificate, please don't forget to answer the survey form. You can see the link in the comment section by Masa University. Click the link, answer the survey, and we will send you your e-certificate for joining today's webinar. Okay.
Yeah, I would like to take this opportunity also to
Mm-hmm.
thank for this session. Thanks for having me, and to all the audience out there.
All right. I also would like to thank to you, Mr. Sapuan, for being here with us today and
Most
share
welcome.
lots of things. And I also myself, I learned lots of things today about the new innovation and the future trends of medical imaging. It is quite interesting, and it is really useful for me. And I think it is also useful for all the audience as well. Okay. So Mr. Sapuan, thank you very much. Hope to see you soon in the next webinar maybe.
Yeah, I not.
All right, with that, thank you, and we end our sessions here.
Okay, bye bye. Pleasant evening, everyone. Bye bye.